I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to recognize and thank each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. The next time you need to see a doctor, or if you have an urgent but not life-threatening illness or injury, a walk-in clinic can offer the fast, comprehensive, and professional health care that you may need. Walk-in urgent care clinics, such as CityMD, are popping up all over the metropolitan area, and this urgent care boom can benefit you as the patient, as well as the hospital systems. Urgent care plays such an important role in overall population health management. You've heard me speak many times to the fact that we need to provide the right care by the right people in the right place at the right time, and urgent care fits that need. In order to make quality care accessible to our patients, CHS has partnered with CityMD to extend our network and make your healthcare as convenient and affordable as possible. Joining me today will be Dr. Richard Park, Chief Executive Officer and founder of CityMD. Our patients can now turn to CityMD for a smooth continuum of care and increase quality and efficiency for all of life's little emergencies. Stay tuned to find out more about this partnership on today's episode of CHS Presents Health Connect.
Once there was a boy who did the same thing again and again. One day he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Hi, and welcome back to CHS Presents Health Connect. CityMD locations specialize in urgent care, providing immediate and affordable medical care for people of all ages. They are a convenient and accessible alternative to the emergency department. And joining me today is Dr. Richard Park, Chief Executive Officer and founder of CityMD, to speak more about the non-life-threatening or non-limb-threatening injuries that can be cared for at your local CityMD Urgent Care Walk-In Center. Dr. Park, welcome.
Well, thank you for that great introduction, Dr. Shaughnessy.
Well, it's great having you here. You know I'm an ED doc like you. Tell our viewers at home how and why CityMD was established.
We talk about this frequently internally,
Yes.
all our staff members and all our leadership. CityMD is here to, we're trusted access. We want to be your trusted healthcare access provider. Mm-hmm. We love to serve. And our core competency, yes, we're ER physicians. Yes, we help avoid the ER. We avoid unnecessary wait times. What we love to do is we love to serve. And that's at the core of our mission. Our mission is to serve kindness. And I got to tell, a lot of times, my own employees and our C-suite members goes, Rich, what is that about? The bankers love that. Mm-hmm. The bankers love serving kindness. They ask, what is that about? And we always tell them, our employees and our leaders, we love to serve. We serve kindness because we've all been recipients
Yes.
of unmerited kindness. And we believe that is infectious.
Yes. Well, it's evident in all of your centers. I've been a patient myself in some of your locations, and it's not just the quality of care that you offer, but it is the kindness and the servitude that is displayed by each and every staff member that really, I think, exemplifies the difference of what CityMD can provide.
Right.
You know, maybe we could branch into a little bit then about, you know, what is urgent care. I remember when we were in residency training, and we used to actually have urgent cares within our emergency departments, right? So the really sick people would go to Section A or the acute area, and then the walk-ins would go to urgent care, and that's all changed now. So what is urgent care, and what kinds of services do you offer at a CityMD location?
Right. So let me talk a little bit about, we'll get to what we do, and what we do is provide access that's connected with other parts of healthcare, namely hospitals and other doctor groups, but the why and how we do it.
Okay.
How do we get the patient's trust and have their interest in mind so that when we tell them you should go there, it's in their interest and that they can trust, they can bank on it. It's about trust, and this goes to the heart of why we like to serve. So when I was growing up, this ties back to always something very personal to a lot of us. And everyone has some story like this. And my story is this, taking my mother to the doctor's office. So immigrant family, you're already disenfranchised. You are not part of mainstream society. And now you enter a doctor's office. And I was probably in 6th, 7th grade when I did this, taking my mother to the doctor's office. And wow, it's a very unpleasant experience.
Yes.
You don't know where to stand. You're not treated well.
Yes.
Okay? You're already self-conscious. You're already sort of feeling embarrassed to begin with. And you're given really a second-rate, second citizen experience. That informs a lot of our decisions. That never happens. That should never happen at CityMD. So whether we open a site in the South Bronx or Jackson Heights, my instruction is that place better look nicer than the one next to Equinox on 69th Street and Broadway, right? It's about respect, and it's how we do it. It's because we like to serve. It's not just the medical care, it's the serving, and to get the patient's trust, because we know what it's like to be there. So that's why we do it, and that's, I think, fundamentally makes us want, and we desire to be trustworthy.
It's a powerful story that ties into the vision of your company that you created.
Right. And to your point of getting patients connected to the right place, to really be sustainable and serve society, what's good for society is that we do a better job of matching right place, right time, right care, all the things that you mentioned. You can have all that ready and all that incredible tools ready and physicians and hospital systems ready, but if you don't have the patient's trust, it won't work.
Yes.
So again, we aspire to have the patient's interest always number one. You know, my wife and I, we always talk about what's important in our lives, in our children, as we raise our 2 children. We have a 17 and a 15-year-old. Religion, charity, handbags are important, okay? Top 3. The order is everything.
Yes.
Right? So for us, patients are number 1. Doctors are number 2. When you have the patient's interest in mind, you can be trustworthy. Number 2 is the health system, and to be trustworthy to the health system. When you have those 2 in that particular order, you can do the right thing and get patients to the right place.
That's excellent. So let's take a look at a video to meet some CityMD doctors and what types of patients they see.
CityMD treats patients of every description for a multitude of complaints. See people with complaints as simple as sore throats, bronchitis, sinus infections, to orthopedic injuries such as fractures, lacerations, and we treat every age from little children to the elderly.
We see an array of different patients from different ethnicities to different health insurance policies as well as self-pay. CityMD in general, we really strive to help patients that can't afford it, or even if you do have the money to afford it, we have a lot of resources a lot of urgent cares don't have. We kind of function almost like an emergency room. We're able to order same-day tests. I see cases from a simple flu case to a not-so-simple flu case, maybe someone who has pneumonia or a lot of comorbidities with it. Someone that comes with an abdominal pain, I can order a CT scan. And we have a lot of collaboration. A lot of the doctors we work with, a lot of the PAs as well, they come from different medical backgrounds. So we have a great view on a lot of different aspects in the medical field.
The doctors that work at CityMD are an incredible group. They are extremely compassionate and dedicated to caring for their patients. When our patients are seen, not only do they get great care in the office, but when they leave the office, our aftercare team takes over. Any lab or radiology study that they have is followed up. Our patients get follow-up calls if they need a specialist. We are here to help them get to the next step in their care, and we walk them through every step of the process.
In aftercare, there's two departments. There's our general aftercare, which is comprised of clinical assistants and highly trained physicians that help answer patients' clinical questions and provide guidance post-visit. We also have a second team that's known as our concierge. They're a team that provides patients to the next step of clinical care. We ensure that the patients go to a specialist that will treat them like CityMD treats them, and they get the best high-quality care possible.
When CityMD was founded and when aftercare was founded, it was with the goal of treating our patients like family members and making sure that they get the same care that we would provide to a friend or a family member.
Really try to go above and beyond. It's really not just about the money in healthcare insurance itself. It's really trying to help the patient out at the end of the day.
To me, why patients should come to CityMD is truly the compassion and care and quality that they get. From all the way from our founder, Dr. Park, who is known to give out his personal cell phone to patients when he sees, to our other partners and physicians that truly care about our patient, that will go above and beyond for their needs, to the staff member that will place 5 phone calls to specialists to ensure they find the right specialist. We are a team that cares about the patient first and foremost. And then we ensure that we treat them with kindness and empathy. We're open all the time and provide access. So when you need us and when you're sick and not feeling well, we're here to take care of you and hopefully help get you better.
Wow, so what a powerful video. Let's take our viewers through what would be the life of a shift, if you will, in a CityMD location. What types of things are you managing and what types of conditions are you seeing?
It starts with the providers. Everything is architected. It all starts with the intent. Okay, so it's very clear. Our job is to serve society. So our job, in that sense, is to help make healthcare better and more affordable. That's the intent, and so now you got to design it to do that. Okay, because unless you design it that way, so we hire ER physicians or physicians that are experienced in the emergency room, because our primary job is to make patients' lives easier so that you don't have to wait unnecessarily in a busy ER when other sicker, more life-threatening patients are being taken care of. So again, to your point of right place.
Yes.
So when you're taking care of people in the right place, you can help save and deliver better care and help society. To do that, we believe you need ER physicians or ER-trained or ER-experienced physicians that work in the emergency room, right? What better way to avoid going to the emergency room than people that have people that work in a cost-effective, efficient, pleasant space.
So as we saw in the video, these are providers that are seasoned and experienced. And again, if it's a life-threatening, limb-threatening emergency, you go to the ED. But we see all the time ED utilization is many times not appropriate. Why? Because access is broken in this country in healthcare. That's where I see your organization really filling such an incredible niche, which is really an access point between primary care and emergency care. Would you agree?
Trusted access, absolutely agree.
Yeah.
You know, we talk about access. There's not enough primary care doctors. They're retiring faster than we can create them.
Correct.
And on top of that, you put so much administrative burden on the physician that effectively the supply of face time with providers is essentially zero.
Diminished.
The supply and demand curve doesn't fit. It doesn't even meet anymore. We have to change the way we do things. And you have to do it in a responsible way. So urgent care, responsible, trustworthy urgent care, has the trust of the patient and the trust of other providers. Our job is to take care of the fractures and the sutures and the abdominal pains and provide access where it's the safety net. Right. You should absolutely have a primary care doctor, okay? You should absolutely have specialists and absolutely have a hospital system to work with. But sometimes there's cracks. This is not a perfect system.
Correct.
When there's leakage and cracks, we're there to support and catch and help and support an adjunct function and make sure, and we'll talk about our aftercare philosophy, of getting that patient back connected to their primary care doctor or their place of belonging. Most patients don't realize this, but you, whether you know it or not, you belong to some healthcare risk group, whether it's your employer or a hospital system or these accountable care organizations. You are a member somewhere. Our job at CityMD is to help identify that, take care of you, avoid the ER, make it a pleasant experience, but more importantly, get you connected back to your medical home.
Dr. Park, that is an excellent point. We're going to talk next about how CityMD and urgent care fits into providing integrated, seamless clinical services in just a moment. We do have to take a quick break, but we'll be right back with more CHS Presents Health Connect.
He helped me learn to read.
It is the best feeling in the world. They impact me. I'm proud of the work that I'm doing.
There's been dramatic results in our kindergarten classroom this year from having a foster grandparent.
Welcome back. Today we're speaking about how the demand for urgent care is on the rise. Through CHS's partnership with CityMD, we are making it easier for you to receive the treatment you need without a visit to the hospital emergency room. Joining me now is Dr. Richard Park, the CEO and founder of CityMD. Welcome. So, Dr. Park, you had shared a little bit about the philosophy of CityMD and urgent care in general. Can you share a little bit about how it fits into the overall healthcare paradigm between primary care and emergency care? And then I think you have a very, very unique product and system in your aftercare program. So again, as ED providers, we traditionally have always lived in the here and now. Treat the patient, treat the emergencies, send them on their way. But your model is quite different. And I think the viewers at home would love to hear more about that.
Right. Again, the point here is trusted access and trust from patients and providers. So how do we bridge that and get everyone working well together? Because that's the problem. Healthcare is so fractured.
Yes.
How do you help and be that trusted vertical integrator? It's big words, but getting people to the right place. So we are not primary care. All of us are emergency room physicians or experienced in the emergency room. We're not primary care doctors. We don't do continuity of care. We don't manage your blood pressure or your cholesterol, your diabetes. Right. It's episodic care, right? And so it's access. When access doesn't exist, let me give you the story of access. My wife had poison ivy a couple of months ago, and I live with her. I'm an ER doctor. In fact, I'm an urgent care doctor. And she doesn't even ask me. She Googles treatment of poison ivy.
Like most people do.
Like most people. So I could preach trusted access all I want. I can't even do it in my own home.
Yes.
But one day, my wife will come and ask me instead of going to Google. So it's access. Who do you go to for information? Who do you trust?
Right.
So that's our goal. And it's to do that in a very responsible way.
So, again, you guys, and I want to just set the record straight because, let's be honest, sometimes urgent care, and not specific to CityMD, gets a bad rap. Well, they're competing with primary care, they're managing chronic disease. You are not. You're treating the acute episode. And what I like, as you mentioned, you're an integrator. So many times we have patients who are unassigned. They don't have a primary care doctor. You treat that episode, and then you have a system where you plug them in with a primary care provider and hand off that patient. And you've got some really innovative technology with caring people who are service committed to make sure that transition happens. Let's speak about that. That's an important differentiator.
Absolutely. I'm glad you touched upon that because you're right. Half of our patients, Dr. O'Shaughnessy, don't have a primary care doctor.
Right.
50% of the patients that walk into our office don't have a primary care doctor. Right. And even if they do, sometimes there are primary care doctors on vacation. They're not always available. We are an adjunct, a support system. And again, our patients come in for episodic needs. They broke their leg, they broke their hand, or they have chest pain. It's an episodic thing. Yet we need to close the loop. We need to get that patient safely to the next care provider, whoever that may be. And that is not us. It's either the primary care doctor sometimes, it's the cardiologist, or the emergency room, sometimes it has to be.
right.
You have to get them to the right place. So we, over the past 13 or 14 years of doing urgent care, we've realized a lot of the work falls between the cracks during the handoff.
No question.
And how do you bridge that? And we found that the only way to do that responsibly is to get very active, because patients, once they leave your office, left to their own, they can't get or navigate themselves to the next place. Healthcare, for no fault of their own, healthcare is so complex.
So how do you navigate them?
We call that process aftercare. And a lot of our work, in fact, I would argue more of our work occurs after you leave the office, because our job is to make sure you land safely. And we call that process aftercare. We call it after you leave, and it's still care that connects after you leave, aftercare. And it's really an integrated technology platform. I hate to use these words. It's a customer relationship manager. They call it a CRM.
I call it air traffic control for patients.
Air traffic control. So the trust of the patient. So when you call them, they pick up the phone, because everyone's calling them.
Yes.
Number one. And also to be trusted by your healthcare partners, because we have to deliver them safely. Again, 50% of our patients don't have a primary care doctor. We have to get them to a primary care doctor. And Dr. O'Shaughnessy, you'd be surprised. They come in for an ankle sprain,
Yes.
and they'll ask, you know what, I haven't seen a doctor in 4 or 5 years. Do you recommend? It's an opportunity. When you gain the patient's trust and you deliver great service and kindness, you have an opportunity and a responsibility to now interject and get that patient to an orthopedist, but also to a primary care doctor, because that patient is also overweight,
Yes.
may have diabetes.
Yes.
There's a lot of other things and opportunities too.
You hit the nail on the head, and I think that is a perfect segue into our relationship. And as you know, CHS has built a clinically integrated network with a strong emphasis on population health, and again, going back to the right care, delivered in the right place by the right team, with the overall goal of not just bending the cost curve of healthcare, but bending the disease curve. How many of those 50% of those patients that they may be pre-diabetic or have early signs of hypertension, and by you using the well-trained staff that you have with that technology, plugging them into our physician network, many times we can delay disease onset, get people healthier, which means overall improvements in the quality of care across the board. And that's one of the things that we're very excited about with our preferred partner relationship. All of the 22,000 employees in our network are connected in with CityMD, and our clinically integrated provider network also is connected in with your network. Have you seen some positive results of the engagement so far? I know we have.
Right. Absolutely, we have, and it's let me, Dr. O'Shaughnessy, it's an honor, and it's a privilege, and it's a responsibility that we take very seriously. That you've entrusted to us your employees and their families.
Yes.
That is no small thing, yes. And so we hope to serve to the best of our ability, and to be trustworthy, to deserve that trust and responsibility.
Well, you serve and you serve well, and this is why your business model is so successful. And we think, as Long Island's second largest healthcare system, and growing and expanding, and an exceptionally high quality network, that's why we wanted to partner with you. So thank you, Dr. Richard Park, for being here. My final thoughts on today's show right after this. So some final thoughts on CityMD and our discussion today around urgent care. Urgent care I see as a key integrator in healthcare delivery services. You heard Dr. Park share where he feels and where CHS feels urgent care fits in, providing a valuable service between primary care and emergency care. It really is a true integrator that prevents gaps in care, and also, I believe, has the potential to recognize earlier signs of disease. So even aside from the emergency that you may be going in for, they may pick up the fact that you have undiagnosed hypertension, high blood pressure. You're maybe in a situation where you're moving towards development of diabetes. They can plug you in with the right primary care provider and get you on the path to health and wellness. And now for my health tip and solution of the day. I wanted to talk about really where you should go for an urgent care services and the types of things that you should see there. And I'll start by saying I remember just a few weeks ago seeing a father and his son going down to the beach with their fishing poles and going to spend some quality time together to do fishing, and literally not more than 10 minutes later, unfortunately, the poor little boy accidentally got the fish hook caught in his finger. And with a severe amount of pain and discomfort, and literally we're right able to get them up the block to a CityMD and get taken care of. And so my tip and trick is really about knowing who is the trusted source of information. And you heard Dr. Park mention, and so many of us will go to immediate sources on the internet and Google something or try to look something up and perhaps make a self-diagnosis. While it is tempting to do that, and I'm not saying that there's not opportunities for learning and information on the internet, please see either your trusted healthcare provider. If you have a sign or symptom, if something's not right, early recognition means everything. And it could be from something minor, such as a rash, a sore throat, an earache, a minor traumatic incident like a laceration or trauma to an extremity, or it could be some more ominous signs and symptoms of a serious disease process. Don't self-diagnose. Don't be an internet doc or nurse. Get in to see the proper provider. And even if you don't have a primary care provider, stop in and see a CityMD doc. They'll plug you in with one after they take care of the acute emergency. If you'd like to know more about CityMD or to make a gift in support of this or another program that is important to you, please visit chsli.org. From there, you can click through to one of the websites of each of our healthcare partners for more information on ways to give. We are grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like me to answer on future shows, please send us an email at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.